Hello, thank you for joining us. Welcome to our latest Public Health Conversation Starter. This is a series of discussions we are having with thinkers who we think provide a critical perspective on the work of public health. Today, I have the privilege of speaking with Dr. Michael Curry. Dr. Curry serves as President and CEO of the Massachusetts League of Community Health Centers. The League represents 52 health centers, serving over 1 million patients. In 2021, the Boston Globe Boston Magazine named Michael Bostonian of the Year. He has co-chaired the state's Health Equity Task Force. He was president of the Boston branch of the NAACP and has more than 20 years of service in the organization. Today serves on its board of directors. I am really delighted that Michael has joined us today. Michael, welcome. Thanks for joining.
Glad to be with you.
Can you just by way of sort of perhaps a soft introduction, tell us a little bit about your background, your journey, and how your journey has led you to this deep concern and commitment to health equity?
Yeah, Dean, so one, honor to be with you in this work of health equity and this reimagining of the city of Boston, Massachusetts, as a place that we can actually address these critical issues. I consider you a friend and an ally in that work, so honored to be with you. I always tell people that most important part of my resume is the fact that I'm a child of a mother who came here for the warmth of other suns. If people have read Isabel Wilkerson's book, of that great migration of Black families who moved out of the Jim Crow and South generally and moved into northern cities. My mother was one of those African-American woman, moved to Boston, no kids in tow. She actually left my older sister in Alabama and moved here for opportunity as a domestic worker, eventually had me here in Boston at Boston City Hospital. And I was a kid who grew up in Roxbury. So I was unfortunately in that experience witnessing much of what many Black families witnessed who had moved to northern cities and particularly metropolitan areas: poverty, police abuse and violence, having adults in your household and neighborhood being relegated to certain jobs and not having doctors and lawyers in your communities. I grew up in a housing project. And to your question, I got to see the product of racial division and inequity in society and the eventual health inequity that comes from that. You don't have access to good food, good jobs, a good education, good environmental infrastructure. What happens is you end up sick. And I went around my communities and people who look like me were disparately sick and dying of diabetes, heart disease, cancer, name it. And I was a patient at a health center. Hence, many years later, why I'm honored and humbled to now be in the role of president and CEO of the Massachusetts League of Community Health Centers. That's what gives me my passion around this work, is because I have the lived experience of knowing what it looks like when people are gone too soon and are living sick.
That's terrific. I mean, you have, as we have discussed, a really interesting story, and I think how you've been able to weave that into the work that you've done has been truly an inspiration. Thank you. Let me fast forward. Fast forward to 2023. We're in this post-COVID period, recognizing COVID is going to be with us for a long time. Many people still suffering from the consequences of COVID, but societally trying to reckon with what had just happened in the past 3 years and how we move forward. As you look back and you look forward, two questions. Number one, what did we do right and what did we do wrong? And the second question is, what do you want us to learn from this moment? What do you want us to remember 5, 10, 20 years from now?
Yeah, I think it's interesting to start with what we did right. So what we did right was in Massachusetts, and I think you saw pockets of this across the country, but I think we did it better than many other places in the country. And we did it because of folks like you and Reverend Liz Walker and Reverend Willie Bodrick and a whole host of people I could name and throw out at folks who were the compass in the room. And I say compass, not your gut, meaning that compass is guided by your research, your study, your conversation, your knowledge of communities, your awareness of inequities. We had really a collection of leaders in rooms to say, no, that's not what we should do around getting testing out. No, that's not how we should message about this disease and the impact it's having. We need to provide safe sites for people who live in congregate or congested households so that they have access to isolate. We need to speak the language of the communities as we reinforce the importance of taking a vaccine. We need to prioritize Black and brown folks who are dying at 40 and 50 years of age, not 75 of COVID-19. We had a huge collection of leaders and advocates and community activists in the right places, right time, lifting up their voices. And we did it in unison together in all those spaces. And Massachusetts right now ranks as one of the best states in the country in terms of its response to COVID. That did not come by accident. That came through hard work and advocacy, and quite frankly, making people uncomfortable at times. So we did that right. How do you, I always lift up Congresswoman Ayanna Pressley's quote. She said, those closest to the pain should be closest to the power. What COVID-19 forced us to do is to put people closest to the pain, or in this case, to the disease, closest to the power, and the decision makers that would decide who got contact traced, who got resources, who got rent relief, as well as who got a vaccine. I think we did that extremely well in Massachusetts because folks had a seat at the table. What I think we did wrong, is we don't get public health very well in this country, and we didn't do it all that well here. We didn't message around what was COVID-19 very well and what we did not know, whether it was the CDC, as I think leadership in the federal government has attested to recently, that there were errors along the way. I think we did that wrong in even local public health settings. We didn't say that we didn't know. We don't have a comfort with saying, we don't know if it's 3 feet or 6 feet, you stay away, or we're still trying to figure out what the disease is, if it's airborne early in the pandemic. We got to be able to tell people what we don't know and allow them to sort of walk through this with us instead of assuring them of things that we don't know as fact. What it did is it eroded the trust that people have in public health. So that's one. Honest messaging and honest messengers is a key part of that. Two is we realized that we defunded our public health infrastructure in this country, that our local public health departments, which are often fragmented, fractured, understaffed, under-resourced, couldn't step up in the ways that we needed them to. They didn't have the resources to do the messaging or the community engagement or to pop up the vaccine site in the church or in the parking lots of our communities, or to galvanize and gather folks together around a strategy. Unfortunately, we didn't do that very well, and we knew a pandemic was coming. It wasn't a matter of if, it was a matter of when, and we know it. Policymakers, Dean, you and your colleagues have lifted this up, and yet we were still not prepared. So I think we didn't do that well. Last but not least, and most importantly to me, we didn't do equity well. And though we did it better in Massachusetts, and I would say I always coined a phrase in college, we were the best of the worst, right? There's some worse places, particularly in the South, that didn't do this well, and oftentimes over partisan divisions. But we didn't do that well. We know John Snow 101, that you have to collect data in order to have the right interventions, the right strategy. We didn't collect that data very well. So how do we know among race and ethnicity, age demographics, who's most sick, who's hospitalized, who's dying? We didn't do that well before the pandemic, and we didn't do that well during the pandemic. And then two, we weren't honest, Dean. And I think that's the part that I've been really trying to lift up, is if you really want to get trust in public health and trust in healthcare, which is really weak at this point among certain communities, I say they don't trust us because we haven't been trustworthy. And trust starts with telling the truth about our system, about the history of our system. I get to do that when I teach a public health course, but I get to tell them about J. Marion Sims and his experimentation on slaves. I get to talk about Tuskegee syphilis experiment. I get to move from those sort of historical perspectives and inequities in health, and then talk about Institute of Medicine's unequal treatment, and then lived experiences today, and say, if we can be honest about how our system doesn't treat people the same, how we've experimented on, abused, neglected, overlooked certain communities in our history, whether that be in the care that we give or in the social determinants of health that make the conditions what they are in our communities, then we can move forward from that. But it starts with a reckoning. I maybe would argue a reconciliation around what has happened in this country that makes certain zip codes, certain neighborhoods, certain households, certain races and ethnicities more sick and more likely to die under a pandemic or in everyday life. So I think we have a lot that we learned, some good, some bad, and most importantly, bottom line is we can do great things together, Dean. I realized, because I was on every task force known to man and woman during the course of this pandemic, some national, some local, is when you get really good people, smart people in the room, and I don't mean smart, just academic smart, street smart, community smart, organization smart, NGO smart. If you get really smart people in the room and you put our heads together, we can do anything. We can solve for diabetes and heart disease and cancer rates and the inequities but we realized that in COVID. I hope we carry that forward.
I think the last 2 minutes, what you just said should be required watching for any student of public health. Thank you. And for anyone who's interested, we actually just did a public health conversation starter with Congresswoman Presley, which is available for anybody who's watching this. Let me ask about values, because I increasingly think that values are core. Getting our values right in terms of guiding how we think about creating health in populations is critical. If I were to force you into 3 values, it's many values, so this is going to push us into a box. What 3 values today, 2023, learning what we have learned, would you like to make sure that we put front and center for any of us whose business it is to create health in populations?
Yeah, I think values, and if I could boil it down, and to your point, Dean, there's so many that go through my head that I think are critical. Maybe inclusivity would be my first. And I think there's so many aspects of inclusivity. Now we typically think of inclusivity with the DEI, diversity, equity, and inclusion, from a racial and ethnic perspective, but I think it's broader than that. Inclusivity is so important when we think about who's at the table. My predecessor here at the Mass League used to say, if you're not at the table, you're on the table or you're on the menu. And I think it's such a powerful truth, which is if you have inclusivity, then there's somebody at the table who says, wait a minute, that's not equity. Wait a minute, there's a voice missing. Wait a minute, that policy or that practice is going to have an adverse outcome on a patient or on a community or on staff. I think inclusivity is one that is so critical to the work that we all do. I don't really care if it's a pharmaceutical company doing research or an academic research center or a hospital, academic or teach or community, a health center, a minute clinic. Inclusivity is such a critical part of that. And in line with that, diversity. I do believe, again, if you're not at the table, you're on the table, you're on the menu, is diversity matters. That we need to realize that diverse perspectives bring a wealth of solutions and opportunity to the table. It is how we gain trust with people. Is I know someone who represents my interests is in the room, has my perspective. I think there's a unique, specific difference between those two. We need to make sure that we're realizing that 5% of our doctors in this country being Black is a crime, is a failure, better yet, on this society's part to recognize that talent lies in all of us and that we're leaving talent on the table in Roxbury and Chelsea and in Lynn and in Southside Chicago, North Minneapolis, East St. Louis. There is a talented young researcher, a physician, that we all need and that we're all relying on to live, that we'll never know because we're not investing in the academic rigor, the social supports, the safety that are necessary for that person to thrive and be successful. And then I'm tempted to say love in the Dr. King sense of love, right? The love for humankind and manhood and womanhood, humankind, that we recognize that we may have political differences and we may see things differently, but when we sit down at a table to figure out a strategy around how to treat disease, protect against disaster, how to make sure people are living healthy lives and prevention, we got to put all of that aside. We didn't see that during much of the last several years. Partisanship drove us apart. But that love for humankind has to bring us together to say, no, we need to make sure that whether you're in an urban area or a rural area, whether you're red or blue, a Democrat or Republican, a conservative or liberal, we got to do what's in the best interests of our fellow citizens and of our society. We don't get that very well, Dean. That division often drives us to ignore tragedy and inequities in society. So I think love, as cheesy, if lack of a better word, as that may sound to some people, I think all we need is love. I'm not going to try to sing it right now because I'll embarrass myself, but all we need is love.
I will take love, inclusivity, and diversity any day. Let me change topics for a second and ask you about primary care, because you oversee the Mass League. You have this large network of primary care centers. As you know, I'm trained as a primary care physician, so it's close to my heart. One of the things that I find whenever I'm speaking to colleagues and physicians, nurses, students in primary care is when you're in primary care, it is intuitive to you that the world around us matters for health, that what we might call upstream matters for health. When you're in primary care, you recognize that being unhoused matters for health, that actually not having access to stable income matters for health. So I often feel that when you're in primary care, you have this tension that you're responsible for the day-to-day well-being, clinical health of your patients, but also seeing your patients as people affected by context and wanting to help fix context. And I'm just wondering how you grapple with that tension and perhaps how you frame a productive approach to dealing with the immediate urgent health needs, but with the important larger agenda that anyone in primary care needs to keep in mind.
Yeah, Dean, I think, of course, we hear in many of the circles that you and I are in, people, this recognition, this heightened recognition that 80+% of what drives your health status has nothing to do with the care you get within a healthcare setting. That 80% plus of what drives your health status is your access to healthy foods, your access to an education, living in environmentally safe communities, access to working out and gyms and fitness and so many other things that are outside of the four walls of a medical facility. That being said, we still have to deal with the 20 or so % that is arguably treatment and arguably, after the Institute of Medicine's report, unequal treatment. But I think, to your point, I always go back to our roots, as I say, when I think about my Alabama mother, as they would say, roots, is we come out of a tradition of understanding that it was never just about care. Jack Geiger, one of the architects of the health center movement, a civil rights activist, and Count Gibson and Elsie Dorsey and John Hatch, who I had a chance to spend some time with a few months ago when he had me come to his lecture series. And Dr. Smith in Mississippi, who was one of the founders of the Medical Committee for Human Rights. Dr. King, at that 1966 meeting in Chicago of the Medical Committee for Human Rights, said, they seem to forget there's a cause for every ailment. I'm sorry, that's not the quote. Of all the forms of inequality, injustice in health healthcare is the most shocking and inhumane, which is actually not what he said. The actual quote is a little different. He said, of all the forms of inequality, injustice in health, not healthcare, is the most shocking and inhuman, not inhumane. And of course, there's a distinction in those words. So to answer your question more directly, there's an awareness in this health center movement that it's about those upstream factors that drive your health. It is not doing us any good for me to treat your disease, us to treat your disease, and then send you back into those same communities that made you sick in the first place. Those same conditions, those rat and roach infested houses, those environmentally unsafe neighborhoods, with the trauma and the violence, whether it be police violence or community violence, with drugs and access to guns, in communities where it is it's a food desert and it's hard to get access to healthy foods. We know in the health center movement, if you've ever watched the video, 22-minute video, Out in the Rural, Google it. It's on YouTube. This was never about just providing care, this health center movement. It was always about treating for those upstream issues. We still do that today. My advocacy as I travel the country to health centers today, and I get to travel a lot, is I say we need to get back to our roots and remember that it was always about solving for the conditions that make our patients sick and then hiring them, empowering them to be part of those solutions. I think we're getting back to that in a way that I've never seen, and I'm excited about that.
Yeah, thank you for building on the sort of the shoulders of those who've come before us, people like Jack Geiger, who I really like that. Really good words. Last question. I often end these conversations by asking about advice that you may have for our guests, particularly guests who are younger people looking to make a positive difference in the world. What's advice, and perhaps how does that advice keep people grounded in hope?
Yeah, of course, my other hats that I wear is civil rights hats. I'm a president of the Boston NAACP for 6 years. Been on the national board at NAACP since 2014. I get to often deliver messages of hope and why all of this matters. What I would say to all of you is this critical piece: show up. If not you, then who? And if not now, then when? You all have the position and the ability and the opportunity, no matter where you are in your academic pursuits or in your career or in your families, to make a difference. So it's a city council hearing, it's a school committee hearing, it's a legislative hearing, it's a congressional hearing, it's a op-ed that you write, or it's the work that you do when you show up at a Boys and Girls Club or at a local health awareness campaign. It's when you show up when families are impacted by violence and trauma. We all have the opportunity to really show up in ways that'll make a difference. So I say again, if not now, then when? With all this heightened consciousness around racial justice and diversity, and the reality is that a pandemic laid waste on some communities more than others in terms of the lives lost here and across the globe. We now got to take this heightened consciousness and turn it into progress. So I say my advice is show up anywhere, everywhere you can. Be part of the community, be part of the solution, and not just in your career and not just in your households. Answer the call in your communities. And I think I know that I talk to young people all the time. There's a line in the movie The Help, if you've ever watched the movie. It says, "Courage will not skip this generation." I feel that every time I talk to one of you. Courage has not skipped this generation.
I can't think of any better advice than show up. Michael, thank you. Thank you for always showing up throughout your career. Thank you for everything that you're teaching us. And thank you to everybody who has joined this conversation. Michael, thank you for everything you do.
Thank you, Dean.